All right, good afternoon. It's update time. A few weeks ago, I went down to Arkansas again for some testing to see how my body responded to the first transplant. It seems as though that through all the testing they did, the bone marrow biopsy and the MRIs and the blood work, that I'm responding really well to the first transplant. All of the markers and the indicators of cancer look like they're suppressed and reduced by all the different measures and markers they use. So lots of hope for this next transplant being even better. Now, because this chemo and this transplant is so aggressive, it normally takes someone roughly 100 days or so to be recovered from it. And when I get my next transplant, I'll be still inside that window. I'll be before 100 days. And so they said the symptoms of the next transplant, I should expect the same types of things, like the extreme fatigue, like nausea, absolutely demonic diarrhea, like all of the things that I had experienced the first time around, I'll experience again, but probably a little bit higher degree or intensity, because it will be kind of like adding insult to injury, because I'm not quite recovered yet from the first one. So my next transplant is going to be the week of July 15th. And so we'll be driving down a day or two prior to that and getting ready. And I'll be down there for about 3 to 4 weeks, depending on how long it takes me to recover. Then I'll get some follow-up testing done a few months after that to see, how I'm responding to it. And then by December or January, I should know if I'm moving toward remission or not. Also in the last week, I started growing some facial hair back. I got some beard going. My eyebrows came back. It's pretty awesome. I'll call that a win. I woke up one day and I had this face fuzz all over, and it was very strange. And I hadn't shaved or had any need to groom or anything in like 2.5 months. And suddenly here it is. Pretty awesome. I'll take it. Just in time for it all to go away again in a few weeks. Also, in the last couple weeks, I had really bad pink eye in my right eye, and I was on antibiotics for that, like an ointment, for about 2 weeks, and it just wasn't doing anything. My body just wasn't able to fight it off. And I went back to a specialty ophthalmologist, and they gave me a stronger eye drop. They had a different antibiotic and also an anti-inflammatory in it. And I've been on that now for about 4 days. And that's been really helpful, and it's much better. Since the last transplant, I tried working out, and I did like a really hard workout around Memorial Day, but that was way too much, and it thoroughly exhausted me for about a week. I had a hard time, functioning after that, and so I scaled it way back, and I've been just been doing like walks around the neighborhood. But in the last week, I started throwing a light pack on, like 15-20 pounds, and doing a walk with that, and felt pretty good. And so a few days ago, I started doing some like body weight workouts, and that felt pretty good too. So things are starting to progress and move along. I'm gonna do some kettlebell work this week and just see what I'm capable of now. I have had some things popping up, like some nerve entrapment and some tendon issues, and some muscle issues that I went to Next Level Spine and Sports. They're the place I've been going for years, since I was a firefighter, like back in, I don't know, that was like 10 years ago. When I have had an injury from athletics or from work, Next Level has always been the place I go. They're kind of like magicians there for sports injuries. So I went there a few days ago, or maybe last week now, and with a nerve entrapment in my arm. And actually, I probably can show you. That little guy right there in my antecubital space, that little elbow pit, that thing sticking up is not a vein. That's a nerve that's kind of stuck and trapped in my forearm somewhere, and I feel it all the way down to the attachment point in my thumb, and it goes up into my bicep. It's kind of nasty. And so they've been helping me with that and giving me some PT work, and it's actually feeling a lot better now than it was before. But they said it's probably due to some inactivity. My body is very much used to one degree of activity, and in the last couple months, it's been drastically swung the opposite direction. And so, whether you start training and go way too hard, or you stop training and you rest way too hard, your body takes some time to adapt to those things, and there's likely to be some hiccups along the way. So getting back into movement and getting back into working out will be really, really good for me mentally, but also really good for my body as well. So that's all I've got right now, and I'll keep you guys updated. Talk to you soon. We've got a guest. What are you doing? Hello.